I'm Darren Cabo-McCauley, DO, founder and Chief Executive Officer of Concierge Medical Cannabis. Thank you for joining me today as we embark on a discussion of cannabis and mental health, because cannabis can be an adjunctive therapy to both anxiety and PTSD. Anxiety is a broad class of mental health disorders characterized by disruptive fear and worry with varying degrees of physical manifestations, including shortness of breath and abdominal discomfort. 42 million Americans suffer from anxiety, with a lifelong prevalence of almost a third of all Americans at 31.6%. This class of disorders ranges from specific stimuli like speaking in public, specific situations like being outside, or can be more generalized. Symptoms can be mild to debilitating, and they can also be symptoms of other mental health disorders. Anxiety is the number 2 self-reported reason for medical marijuana usage in states and territories where it's available recreationally or medically. Similarly, post-traumatic stress disorder is prevalent in American society as well, with 5% of men and greater than 10% of women suffering from the disorder. There is a lifetime prevalence of approximately 6% of Americans. 61% of men and 52% of women will have an extremely traumatic event in their lives, with 8% of those men and 20% of those women subsequently showing signs and symptoms of the disorder. Common symptoms of PTSD include nightmares, flashbacks, intrusive thoughts about the event, and severe anxiety. Both anxiety and PTSD can be associated with panic disorder, which has multiple physical symptoms, including dizziness, sweating, a racing heart, chest or stomach pain, and nausea and vomiting. The endocannabinoid system plays a role in the regulation of the brain's processing of fear and anxiety. The release of anandamide and 2-AG, in addition to the overlap of endocannabinoid stimulation in the release of oxytocin and dopamine, allow for a sensation of calm and relaxation that is associated with many activities, including exercise, social interaction, and body work, like massage, chiropractic, and osteopathic manual medicine. Perhaps not so coincidentally, a depleted endocannabinoid state is more common in women, as are diseases that are currently postulated to be caused or perpetuated by endocannabinoid deficiency, including fibromyalgia, anxiety, and PTSD. Phytocannabinoids can play a role in the mitigation of some symptoms of anxiety and PTSD, in addition to improving the response to other therapies. Both anxiety and PTSD are often treated by multiple medications, with a symptoms-based approach using a wide variety of antidepressants, anticonvulsants, and antipsychotic medication. Selective serotonin reuptake inhibitors and tricyclic antidepressants have been found to be the most effective for PTSD and have the most rapid symptom abatement in anxiety. Patients are also treated with more powerful medications, including more addictive and potentially dangerous medications such as benzodiazepines. This vast host of treatment options can be very good for some patients, but may also leave others with varying degrees of side effects, significant withdrawal if medications are stopped, addiction, and even fatal overdose. No matter how effective patients find cannabis in the treatment of their symptoms, decrease in other mental health medications must always be done in conjunction with a prescribing physician. There is a dose-dependent relationship between cannabis and its effects on anxiety. Pure THC decreases anxiety at low doses, but can increase it at high doses. CBD decreases anxiety at all doses studied, however. CBD can counteract the effects of THC by binding to the CB1 receptor. A mix of CBD and THC allows for higher doses of THC to be tolerated by a patient without significant side effects. CBD in particular is known to activate the GABA receptors, leading to an increase in parasympathetic activation. This part of the sympathetic nervous system can be thought of as the polar opposite of the fight or flight response Instead, it stimulates rest and digest. Remember, CBD has limited to no euphoric effects and can help patients to function and remain cognitively intact while providing symptom relief. Although many patients and recreational users with anxiety may medicate or self-medicate to decrease their symptoms, when corrected for other factors, there is little correlation between cannabis use and most anxiety disorders. The exception to that is social anxiety disorder, SAD, where cannabis use has been shown to be effective in treatment, but has also been shown to lead to an increase in dependence, perhaps due to its efficacy. This highlights the mantra that cannabis should be used as a bridge to give patients the tools to overcome treatment plateaus or face certain stressful stimuli. Caution should be used when utilizing cannabis as a long-term strategy, as use disorder may become more common and withdrawal from prolonged cannabis use may have a rebound increase in symptoms. Cannabinoids can treat the symptoms of PTSD, including hypervigilance, hyperarousal and insomnia, anxiety, excessive fear, and night terrors. In addition to treating the symptoms of PTSD, cannabinoids may be useful as an adjunctive therapy that helps decrease polypharmacy and may lead to ultimately better control of the symptoms by treating the root cause of aversive memories themselves. However, remember, all cannabis is not the same, and patients with PTSD in particular must be careful to avoid high THC containing products, as they may be subject to overstimulation and subsequently an increase in their symptoms. PTSD affects the size and activity of the amygdala, the portion of the brain that processes emotions relating to fear, memory, anxiety, and pleasure. Not coincidentally, the endocannabinoid system can be thrown into dysfunction by traumatic events. Low doses of THC have been shown to mute the fear and anxiety responses of study subjects, both with and without PTSD, who were exposed to stimuli designed to evoke a fear response. Memory extinction is a natural process whereby memories are overwritten by new memories over the course of about 6 months' time. With particularly averse memories of traumatic events, endocannabinoid dysfunction plays a role in decreasing the body's ability to perform this natural process through dysregulation of the hypothalamic pituitary adrenocortical axis. Similar to the effects on anxiety, low-dose THC with CBD used to mitigate the potential side effects of increasing THC doses has been shown to help with memory extinction and overwriting. Thank you for joining me in this discussion of cannabis and mental health. I'm Dr. Darren Caba McCauley from Concierge Medical Cannabis. I hope you join us again.